just to have that going. Yes, and I'm going to now share my presentation. Okay. And away we go. So thank you so much for joining us. My name is Tommy Cecino Edichico. I'm representing the Pride Center of Staten Island. In addition to my team, I have represented here in New York City Health and Hospitals, Transgender Legal Defense and Education Fund, and Sun River Health. I will give a proper introduction to each panelist, but first and foremost, I will introduce myself. So again, my name is Thomas Cecino Edichico. My pronouns are he, him, his. And I am the Counseling Services Manager at the Pride Center of Staten Island. And so what does that mean? Essentially, I cover everything under the Supportive Counseling Services Program, the TGNC Supportive Services Program, and the Clinical Internship Program. I will speak a little bit more in depth to a little bit more of the programs that we provide, but I will do that a little bit later. I want to give everybody a context to why we're here today, and why this is happening. So talking about Transgender Day of Visibility. So Transgender Day of Visibility was founded in 2009 by Rachel Crandall, a Michigan-based transgender activist and the executive director of Transgender Michigan. It was started as a day of awareness to celebrate the successes of transgender and gender nonconforming people, and is an important day for the LGBTQ TGNC community. I have a quote from her directly stating the reason as to how this kind of came about for her. And she said, and I quote, "I went on Facebook and I was thinking, whenever I hear about community, it seems to be from Transgender Day of Remembrance, which is in November, which is always so negative because it's about people who were killed." So one night I couldn't sleep and I decided, why don't I try to do something about that? And hence, this day was created. Transgender Day of Visibility illustrates the importance of transgender representation worldwide, especially as transgender and gender nonconforming people face risks every day. Recent polls show that 1/4 of people in the US say they personally know someone who's transgender. Visibility as a transgender person is not a one-size-fits-all approach for people within the trans community, as is, I think, the transgender experience itself. Over 20 states introduced at least one anti-trans bill in 2020. Again, I will try to send out this information to everybody so that they can see the links and resources that are provided throughout this presentation, so that they can have that information accessible. So Trans Day of Visibility focuses on transgender and gender nonconforming, I'm going to use the acronym TGNC a lot, people, but it's not exclusive to the TGNC community. Allies of the TGNC community can also take part by reaching out to a trans friend and sending their support. Those who live in states that are trying to enact anti-trans legislation can write to their state representative to oppose those bills. Within their social circles, allies can be visible and vocal supporters of the TGNC community. So I want to introduce Lieutenant Governor Kathy Hochul, pronouns she, her, hers. She is the 77th Lieutenant Governor of the state of New York. I have a little bit of biography from her. Lieutenant Governor Kathy Hochul began her career in public service on her local town board before serving as Erie County Clerk and then as a member of Congress for New York's 26th Congressional District. Since 2015, she has served as the highest ranking female elected official in New York State government. Lieutenant Governor Hochul has successfully spearheaded numerous initiatives and leads the administration's economic development and job creation efforts across the state, working every day to advocate for policies that help all New Yorkers make ends meet. So I'm going to pass it along to her in a message that she so generously recorded for us.
Hi, I'm Lieutenant Governor Kathy Hochul, and today is International Transgender Day of Visibility. It's a day when we unite around the globe to shine a spotlight on the amazing contributions that the transgender, gender nonconforming, and non-binary communities make to our society. Here in New York, we celebrate the legacy the trans community has had on the culture and the history of our state, and what's made it be a beacon for the LGBTQ community. But we first must acknowledge that there have been sickening displays of hatred and violence and discrimination happening daily, sometimes hourly, against the transgender community, and all too often against transgender women of color. And while we've made progress in New York, look what's happening around the rest of the country, with over 80 new bills in state legislatures seeking to roll back rights and discriminate against transgender individuals. And even worse, so much of this legislation targets trans youth, whether it's blocking essential health care or restricting participation in sports. It's absurd and absolutely unacceptable, and we cannot stand for it. So let's use today support and lift up our transgender and non binary young people who've shown the courage to share with the world who they are. We must double down on our commitment of ensuring we create a more equitable and just culture that is welcoming and respectful of them. Because our next generation doesn't deserve to have to live the same struggles that we may have faced. Yes, we've come far with gender equality, but not nearly fast enough, and especially not for my trans sisters. They deserve to be treated with dignity and respect just like everyone else. And we in New York are making progress toward that goal. We made progress when we passed GENDA, the Gender Expression Non-Discrimination Act, which officially banned discrimination on the basis of gender identity or expression. That was an important step to leveling the playing field for all in the transgender community. And it was your state government telling you, we see you, you matter. And we made progress when the Department of Health began offering a non-binary gender marker on birth certificates last summer. We made progress when we passed a law requiring that all single occupancy public restrooms be designated as gender neutral. And most recently, we made progress when we repealed the walking while trans ban, which was another significant step toward righting a historic wrong when law enforcement was targeting and over-policing members of the transgender community for too long, and we said enough is enough. We'll continue to urge our federal leaders to support and pass the Equality Act so the cruel laws being enacted across our country will be invalidated. But for now, we must continue to do everything we can to support transgender and gender non-conforming people of all ages right here at home. From housing to employment, I know our transgender community is often disproportionately impacted, so we have to continue to invest in targeted programs that serve trans New Yorkers. I know there's already so many incredible people already doing this work, like the Allie Forney Center and Sage. Thank you all so much for your help. And above all, we must teach one another to treat people with kindness and respect, no matter who you are or what you look like. That's what we do in New York, and I want you to know that not only on International Transgender Day of Visibility, but every day. I see you, you are appreciated, and New York stands with you. Thank you.
Awesome. And we are very grateful to be able to have received those words. I hope that, they resonate with y'all as they have resonated with my team. So first, stepping into our panel discussion, I will be talking about the Pride Center of Staten Island. So the Pride Center of Staten Island provides a wide range of services, revolving around the focuses of community, education, and empowerment. So we have youth services program, we have our Girl Power and Women of Worth programs, we have our SAGE senior services, HIV prevention services, our Love on a Leash program. We have a grief space for monthly as a bereavement group. We have all sorts of LGBTQ resources and library. We have our counseling support services program, and then our TGNC support services, which will be sort of the general focus of what I'll be covering today. So the Pride Center of Staten Island's mission is to enhance and sustain the well-being of the LGBTQ and allied communities by providing programs and services that cultivate community for LGBTQ interests, educate and empower, and provide social support. The Pride Center of Staten Island envisions a Staten Island where LGBTQ people and families are empowered to achieve their fullest potential, where people of all sexual orientations, gender identities, races, and abilities are valued and feel a sense of belonging, where allies support identities and interests outside of their own. So I will be kind of talking a little bit about the counseling services program. And in that, I just wanted to give a little bit of context to the background that I come from. So I've been with the Pride Center for the past 4 years now, first starting as a mental health counseling intern and then evolving into the position that I am in now. I have my master's degree in mental health counseling from Pace University. Prior to working with the Pride Center, I worked with Vibrant Emotional Health as a counselor for several of their crisis and suicide hotlines, such as NYC Well, the New York State Addiction Helpline. And I have also served as a crisis counselor and mentor to new counselors on the Trevor Lifeline, an LGBTQ youth crisis and suicide hotline. So the counseling services program within the Pride Center of Staten Island provides individual counseling, couples counseling, family counseling, and group counseling. Grief space, or bereavement groups are a perfect example of that. In the sense, the Pride Center is also able to provide support on a need-based perspective, in that, in terms of issues or conflicts that come up within our community, we hope to be able to meet those needs as they emerge. And we have the capacity to do that, which is so amazing. So talking a little bit more about the Trans and Gender Non-Conforming Support Services Program, TGNC. So group services for TGNC individuals and their allies. We, in the Counseling Support Services Program, are able to provide letters of medical necessity to TGNC individuals seeking further gender affirmative care. And we are able to provide linkage to numerous services, which I will talk a little bit more about later. But kind of stepping into the perspective of talking a little bit more about our groups specifically. First, we have G-SPEC, which is short for Gender Spectrum. This occurs weekly on Tuesdays between the hours of 6 p.m. and 7 p.m. It's open to youth between the ages of 13 to 17, and it provides a brave space for youth across the gender spectrum to have facilitated discussions on topics relating back to TGNC-related topics and the intersectionality of the youth experience. So examples like that can look like coming out to family or friends, navigating being out in school, identity development, and so much more. A great feature within this program is that we have a Discord, which is open for youth to be able to connect, share resources, and it's truly been an incredible resource to be able to help our youth stay engaged throughout this pandemic. Next up, we have Transcendence. I also want to take a minute to shout out the creator of this logo. His name is Lawrence, and he is within our Transcendence program, and he had created this logo specifically for us to be able to utilize it to represent the group. It occurs weekly on Fridays between 6 and 8 p.m. It is open to individuals 18 and over who identify as TGNC. It provides a brave space for TGNC folks to have coordinated discussions on TGNC-related topics. Examples of this can include TGNC representation in the media, social transitioning, transitioning in the workplace, and so much more. We have next our Families in Transition group. This meets bi-weekly on Thursdays from 7 to 8:30. This is open to family members and friends of TGNC individuals. It provides a brave space to friends and family members of TGNC folks to help them navigate through their own emotional experience as their loved ones navigate the process of transition. Another special shout out to our co-facilitator, Mary Anderson, who along with Vicky Fasella had created the group initially a few years ago based upon the impending need. And it's really grown and thrived to become a really magnificent program. Next up, we have the Transmale Group. This occurs bi-weekly on Saturday afternoons between 3 and 5 p.m. Open to transgender male identifying individuals 18 and over. It provides a brave space to transgender male identifying individuals to discuss topics relevant to the transgender male community. Again, examples of this can include accessing hormone replacement therapy, navigating top surgery, healthy relationships, and the list can go on. So the linkage to care. So in terms of what's great about the TGNC support services program is that it has created a robust network of providers that we have built reliable and consistent relationships with in order to mutually serve and lift up the communities in which we hope to serve. A few of which are here with us this evening, and I'm very excited to have join us. But we have also ourselves assisted in connecting clients to the following services: legal name change assistance, hormone replacement therapy, legal services, and other gender affirming care. And to circle back to the letters of medical necessity that I had referenced a little earlier, the counseling services program can provide letters of medical necessity for the following purposes: for hormone replacement therapy, for top surgeries, for bottom surgeries, for any additional gender affirming surgeries. An example of this can include facial feminization surgery. And again, these are all provided in due diligence in terms of being able to meet with our clients and determine what the next best steps for them are. And yeah, this has been a resource that we've been extremely happy and grateful to be able to provide to the. So yeah, so the Pride Center of Staten Island is here for you. You can contact me specifically at my information as it's listed on this slide. We have online submission forms for both the Counseling Services Program and the TGNC Support Services Program. Additional support is provided by Golden Brooks and Haley Peterson, our TGNC specialists / counseling program coordinators, and our incredible intern team. You can find us at the following at our website, at the following social media accounts, and then check out our and find out a little bit more about our new location at 66 Willow Avenue. All right. Thank you so much for taking the time to hear me in terms of talking a lot about the services that the Pride Center offers. I'm going to now toss it over to Charlie Arrowood, pronouns they, them, theirs. Charlie Arrowood is the Name Change Project Counsel at the Transgender Legal Defense and Education Fund. So Charlie Arrowood is of counsel to TLDEF's Name Change Project. They manage the Name Change Project's advocacy efforts, develop materials, and assist the program manager with training and education and developing pro bono law firm partnerships. In their private practice, they primarily provide transition-related direct legal services to transgender clients, including name and gender marker change assistance and guidance regarding health insurance coverage. Charlie is the chair of the LGBTQ committee of the Nassau County Bar Association, a member of the National Trans Bar Association, and a board member of Gender Equality New York. Charlie is also the recipient of the LGBT Bar Association of New York's 2021 Community Excellence Award and was named one of the National LGBT Bar Association's 2021 Top 40 Lawyers Under 40. They are a parent of two and graduate of Tulane University with a BA in History at New York Law School in 2013. And also just incredible to have them on board. Please welcome.
Thank you very much. Next. So thank you for the wonderful intro, Tommy. I don't have much more to say about myself except hello and thank you for joining us tonight. So we'll do a little bit of an overview of the services that TLDEF provides and kind of what our programming looks like. And then we'll dig into a little bit of name and gender marker stuff, including best practices for taking care of name and gender marker changes during COVID, a breakdown of federal and state documents. And then I have a list of other local resources available. they're kind of statewide, but I also have city-specific resources available if anyone has any questions or, you know, might need specific assistance with anything. Next. So the Transgender Legal Defense Education Fund, or TLDEF, was founded 18 years ago in 2003. We are New York City based, but have a national reach. So we do impact litigation across the country. We do community education across the country. We have a trans health project that we'll talk about briefly momentarily. And then also a name change project. Next, please. As far as our impact litigation, we're kind of one of the only like big national organizations that does kind of a combination of direct legal services and also impact litigation. And what impact litigation is, you know, sometimes there is a policy that broadly affects a group of people, and one person suing can change that policy for everyone. And so impact litigation is strategically filing a lawsuit or threatening to file a lawsuit in a way that makes it possible to have a big policy change take place just based off the results of that lawsuit. So most of our impact litigation is around healthcare, name changes and ID documents, and then we also do some stuff around public accommodations, jails and prisons. And the most recent stuff that's been going on, there were a couple of cases in Georgia. One was the Lang case, which was a sheriff's deputy who was denied healthcare access because of an exclusion in the employer's insurance plan that said, we're not going to cover transgender care. So that is ongoing. The University of Georgia, we sued to get their faculty and employee plan to cover trans care. And then similarly in New York, there was a case against the MTA's insurance policy. As far as name and gender marker changes and ID documents, we're currently in litigation in Pennsylvania because there is a rule in their name change law that says if you have specific felony convictions, you cannot at any point access a name change. So we are suing the state of Pennsylvania to have that changed because it's unconstitutional in our opinion. And then public accommodations in jails and prisons. One of the most recent ones was up in Steuben County in New York, which is upstate. There was an incarcerated trans woman who was harassed, discriminated against, denied access to medical care, denied access to grooming supplies and other commissary items that she needed. And they were able to come up with a really solid settlement that developed a comprehensive policy for how that county would deal with trans incarcerated people in their jails and prisons. And so that settlement is actually being used as a model across the state for police departments and sheriff's departments and corrections departments that want to come up with a better system than, oh my God, there's a trans person here, what do we do with them? Or we're gonna get sued because we're not allowing this person to access care. Yeah, next please. Public education and advocacy, we do this in a few different ways. We do professional trainings for corporations and nonprofits and law firms, just to kind of learn more about the trans community or about specific topics, lawsuits or big, policy changes that have gone on, 101s for how to work with trans clients, trans employees. We do some state advocacy. Right now, I am working feverishly to get something called the Gender Recognition Act passed, and that would be kind of a major overhaul of the name change process and the document change process in New York. It would remove the publication requirement from the name change statute. It would standardize and streamline the process generally. It would get rid of the doctor's letter requirements to change your gender marker on certain documents, which was done through litigation for birth certificates, but the DMV still requires a doctor's letter to change your gender marker on your license or photo ID. We are developing an administrative name change proposal that would allow folks to go through the name change process outside the court system. So you're not spending the money on going through the court system, and it's not necessarily as intimidating. It's just kind of smoother. And so that is in the very early stages. And we're hoping that, in the interim, the Gender Recognition Act gets passed and folks are able to more easily access documents. They don't have to publish, but ultimately the goal is to get this done outside the court system so that you don't even have to interface with the court. Because if you think about it, when you get married, you go to the clerk's office. You don't go to the court to change or to get your marriage certificate, or sometimes the clerk's office is in the court for tiny counties, but it's a much simpler process than having to go before a judge. The Gender Recognition Act that I mentioned would also make X gender markers available for documents that are issued by the state. So they are already available on New York City and New York State birth certificates, but they're not available on driver's licenses. They're not available in like any of the other benefit systems. And actually, OTDA, the Office of Temporary Disability Assistance, just got sued by the New York Civil Liberties Union and Legal Services of New York City because there are people with X's on their documents who are not able to access benefits unless they misgender themselves. So they are suing to have OTDA update their computer system so that they will be able to issue these markers. And the DMV is also being sued by Lambda Legal for that same reason. The excuse for a lot of these agencies is, well, our computer systems are old and we can only pick M or F, or there's stuff that happens in the background where that gender marker is tied to things. And so we don't want to like domino effect and blow everything up. But that's not really an excuse, because there are people who have differing documents and they need to be able to streamline everything and make sure that their stuff matches and that they're not having to out themselves, or they're not being denied access to benefits or other rights just because they have a document that some random agency does not recognize. At the federal level, again, our goal is to standardize and streamline document change processes. So getting rid of that doctor's letter requirement to change things like passports and social security, and allowing for X gender markers. There's current litigation, particularly around passports for this. And the State Department has been told multiple times by the court that they need to make this change. They still haven't done it. The ACLU is really active on this and is working with the Biden administration to make this a more likely conclusion. And we also focus a lot on enforcement and education. So, making sure that states that have health insurance protections in place are actually covering transgender care, educating judges, clerks, folks who interface with the trans community, making sure that they are able to do that in a respectful and helpful way. So that's pretty much it. Next, please. So our Trans Health Project is relatively new. We run a national healthcare helpline for both individuals and attorneys who are helping folks navigate the insurance coverage process for transgender care. So folks can call that number, and I should have put it on there, but I can get it to you if you need it. Where you can call and ask, like, what do I do next? I got this denial, or my insurance policy says this. How do I find out if this is covered? That kind of thing. Public education. So we're developing a national attorney network similar to our name change project, which I'll talk about in a moment, so that attorneys, if we get a phone call from someone in Florida who needs help with an insurance appeal, we have a person to refer them to wherever they are. And that stands for New York City as well. There are not a lot of people who are experienced in both the health insurance piece and the trans piece. So training especially cisgender attorneys and cisgender service providers to be able to work with the trans community and also have an understanding of how the insurance process works for trans care. That's a major goal of the Trans Health Project. We also educate medical and mental health providers, billing offices, and insurers. So there are a lot of things that go into determining coverage. And we want to make sure that medical professional billing offices know how to bill something in a way that will get it covered, that kind of thing. And that insurance companies know you're not supposed to do this anymore. You're supposed to cover stuff. I'm going to say this till I die. We also do alternative dispute resolution and structured negotiation with employers. So there's a type of health insurance policy that employers get to decide what is covered. And sometimes they decide, or they don't realize that it's in their policy, that trans care will not be covered. And so if someone has a policy like that, we do work with the employer to get them to remove the policy without litigation. So we try to do it before litigation. We try to have a conversation with them, make them see the error of their ways, and make them realize that it is a liability for them to continue to have this exclusion in there and continue to discriminate against employees. We also do structural advocacy, again, with through insurance companies, with state Medicaid programs, to make sure that state programs are covering stuff, to make sure that insurance companies are removing blanket exclusions for specific types of care. So something like mastectomies for trans masculine people under the age of 18, a lot of times are denied because being 18 is part of the medical necessity determination. So the insurance company looks at all your letters that you send in support, saying that you need this thing. You can submit stuff, you can submit medical evidence, everything, but then they say, oh, you're not 18 yet, so you haven't satisfied that this is medically necessary. Nothing magical happens on your 18th birthday. And for a lot of people, it is important that they get things taken care of before they go away to college, while they still have the support of their family to care for them after a procedure or something like that. And so we work with the employers to try to get them to remove that piece of the puzzle. Or they'll say, we don't cover breast augmentation because for cisgender women, that's cosmetic. So we can't then cover it, for a trans woman. But really, that is a diagnosis-based distinction. And so they're saying, it's not medically, it would be medically necessary if you were having breast reconstruction after breast cancer, but because your diagnosis is gender dysphoria, we're not going to cover it. So we try to get them to remove that as well. And we try, again, the same with impact litigation, we try to make a big sweeping change just based on one single case. Next, please. The name change project, this is my baby. We provide free legal name change services to folks in New York City, Long Island, and then we have some other sites outside New York State. We serve low-income trans people at 250% of the federal poverty line or lower. And we work primarily with law firm and corporate partners. So we partner with big fancy law firms who want to give something back. And we assign individual cases to one attorney or a group of attorneys who then walks you through the process, files for you, and make sure that you have what you need to move forward with your document changes, all that. We also do some work with law school clinics. So a lot of law schools have programs for LGBTQ students, outlaws they're called, or Lambda, and we try to set clinics up with them. So we train the students, they're able to get hands-on experience with clients, they're able to then go out into the legal world with the experience of having worked with a trans client and having gotten that training. So I really love doing the trainings and making sure that, people are getting important information. Next. So as far as actual name changes go, I don't know how many folks we have on here who have a need for name change assistance, but I wanted to put a little bit of stuff out there just so folks have a general, whether you're a trans person who needs assistance or you're a service provider, I want to give the broad strokes of the name change process and document change process so that you can, spread the wisdom and at least have an idea, because for a lot of people, it is incredibly overwhelming because they just don't know where to start. So I like to kind of like bring everything back down to the ground, give people a kind of order of operations, and then maybe hopefully it's not as intimidating. So most people are able to change their name on their own. You don't necessarily need an attorney, but a lot of times, particularly for the trans community, sometimes things can be a little more complicated if there's an extensive criminal history, if there is, if it's a minor whose parents don't consent, things like that, you may need an attorney to get involved. And then other people just want an attorney to take care of it. There are a lot of moving parts in transition, and sometimes people just don't have the bandwidth between transitioning and work and life and all that to take care of this on their own. It's nice to have an attorney involved. It's nice to have someone being respectful to you in a universe that generally people don't assume you'll be respected in, going through the court system and working with like a big fancy attorney. So it's really nice and empowering to have that attorney involvement if you need it. The court does have a do-it-yourself program where you just fill in this little form and it generates a final document, but I hate it. I like my templates better because the court program does not allow for a publication waiver request. So the name change statute requires you to publish in the newspaper, which is why we're trying to get rid of that requirement. But the program that the court uses doesn't allow you to ask for that to be waived. And a lot of people don't realize that you can even ask for it to be waived. There's also gendered language, so it's not right for everyone. And it also asks some questions that are not actually required by the statute, like citizenship. And so I like to stay away from that form. If you need a template, please reach out to me. My contact information is on the slides, and I can also put it in the chat. There is a question, where can I refer a client from ACS or foster care system interested in changing their name? I'm going to say the Peter I can never say it, Cicchino Youth Project, Cicchino Youth Project at Urban Justice Center. I think that might be the best bet for you. And I have a contact there if you want me to connect you. Yeah, so if you need a template, we have instructions, step-by-step instructions, and it is often something that's doable on your own. You can save money if you don't qualify for pro bono or free services by just doing it on your own. Yeah, next, please. So I kind of covered this already, but sometimes people do need attorneys. You can just skip it. And another reason attorneys are sometimes helpful, sorry, I have a hair in my mouth, is that sometimes you need to provide the court with specific documents that you are not sure how to access. If you need to contact, if you have a criminal conviction in some other state, you might need to get documentation from them, or if you have a birth certificate that you can't access, you might, it's a lot of times helpful to have an attorney make that phone call instead of just a person who's asking for themselves. Next. So if you're interested, you can fill out our intake form, and then our program associates will contact you to get some additional information and do an intake call. If you qualify for the program, then we'll assign you to an attorney who will reach out to you directly. You'll sign an engagement letter with the law firm. So you're not a TLDEF client, you're a client of the law firm going through the name change program. And right now, mostly everything is virtual as far as meeting with the attorney, signing everything. I've been doing this thing where like I have the person hold up the piece of paper, sign it, and then hold it up and show me that they've signed it. And then they mail me the original so that I can notarize it. The attorney that you work with will file for you and get you certified copies of your order. And that certified copy is what you'll use to change your documents. And then you can reach out to us for post name change assistance. So figuring out how to change your driver's license, passport, social security, everything. Yeah, next. And these are a handful of resources. Some are upstate, some are downstate. I was planning on adding some more New York City specific ones, but reach out to me if you have specific needs, and I absolutely can connect you with the relevant resource. That is it, I think. Yeah, that's my email. And Cynthia, I see your notes in the chat, and I will send you an email with that information. Thank you guys, folks. I'm non-binary. I still say guys. I don't. All right. Thank you.
Thank you, Charlie. Thank you so much. All right. Well, tossing it on over next to, if I can get my slide to cooperate. Yes. Priya Nair, Associate Director of Gender Equity for New York City Health and Hospitals / Office of Diversity and Inclusion. So Priya Nair is the Associate Director of Gender Equity for New York City Health and Hospitals, the largest public healthcare system in the United States. In this role, Priya Nair manages the LGBTQ and gender equity work across the system's more than 70 locations in New York City's 5 boroughs. Prior to joining New York City Health and Hospitals, Priya was appointed as the inaugural Edie Windsor, Sylvia Rivera, and Marsha P. Johnson New York State LGBTQ Fellow, where they served as the policy advisor and project manager for LGBTQ initiatives in New York State. Before the governor's office, Priya was the LGBTQ liaison for New York City Council speakers Melissa Mark Viverito and Corey Johnson. Priya is the secretary on the board of the Stonewall Democratic Club of New York City, and was named on City and State's Pride Power 100 list in 2019 and 2020. A lifelong New Yorker, Priya graduated from Vassar College and currently lives in Harlem with their family. Thank you so much for joining us, Priya.
Hello, everyone. Thank you, Tommy, for that wonderful introduction and for organizing this, as well as to the Pride Center of Staten Island and all my fellow panelists, and for all of you for being here in honor of Trans Day of Visibility. So, as Tommy said, I'm Priya Nair. I use they, them pronouns, and I'm the Associate Director of Gender Equity for NYC Health and Hospitals. So you can go to the next slide, please. And, also, I'll also say in my introduction that I did, start this position in December. So you have to be a little bit, generous with me as I'm still getting the lay of the land. But today I'm going to talk about all the services and care that we provide at New York City Health and Hospitals for trans, non-binary, and gender diverse, gender non-conforming folks. And you can go to the next slide. And, of course, all of you know, as much as I do, that it's how important it is to, be able to get affirming healthcare services. I mean, we're in the middle of a pandemic, which has had a disproportionate impact on LGBTQ people. We are seeing states around the country try to attack trans people, try to limit, life-saving gender affirming care for trans youth. And we know that, on a personal and systemic level, that trans people are more likely to be discriminated against in healthcare, are more likely to avoid seeking out healthcare at all because of that discrimination and fear. So, just to kind of put it into that context, that it's even, more important to be able to get affirming healthcare services. So, I thought I'd first just give you a quick overview of health and hospitals. I know, before I started working here, there are so many healthcare systems and organizations. It sometimes can be hard to keep track of them all. And so, I think it's good to know what we're talking about. So as Tommy said in my bio, New York City Health and Hospitals is the public hospital and healthcare system of New York City. And it's the largest public healthcare system in the United States. And we provide services to over 1 million New Yorkers every single year. And have over 70 locations across the 5 boroughs. And part of our mission is to provide healthcare services, high quality services, regardless of ability to pay. So that shouldn't deter you from seeking healthcare. And so we have the 70 locations. We have 11 hospitals. You know what a hospital is. It's your typical hospital. But then we also have Gotham Health, which is, a network of clinics, community healthcare centers, basically, that do all kinds of outpatient services. So, primary care, preventative care, radiology, you name it. You can get your entire continuum of healthcare at our locations. And I'll just note that in Staten Island, one of our Gotham Community Health Centers is called Vanderbilt, which you all might know about, as well as sorry, I'm about to get to this, but we also have 5 long-term care facilities. So those are like nursing homes, rehabilitation, facilities, and then we also have one of those on Staten Island as well. Called Seaview. So in addition to those, the Gotham Health clinics, the hospitals, the 11 hospitals, the long-term care facilities, we run Metro Plus as well, which is a low to no cost health insurance option. And we also, do some of the health, run some of the health services in corrections context in New York City. And I'll also just note, we've been working on the LGBTQ program for many years now, way before I got to Health and Hospitals. And all of our qualifying facilities do participate in the Human Rights Campaign's Healthcare Equality Index, which measures the extent to which you're providing the LGBTQ affirming care. And so all of our facilities have received, the highest designation in that index for the last 5 years. So we are really, really proud of that. You can go to the next slide. So that's the overview of the system as a whole. But within our system, we also have 5 Pride Health Centers, which those are designed specifically to focus on the health needs and disparities of LGBTQ communities. Each Pride Health Center has, dedicated staff. They've gone through, more advanced training in LGBTQ affirming care. The providers themselves, may identify as LGBTQ, or they're just really dedicated to our communities. And so the 5 Pride Health Centers, they're located in Manhattan and Brooklyn. So we don't have one on Staten Island at this time. But they offer all kinds of services, which are really important to know about, primary care, preventative care. Primary care includes hormone therapy. At the Metropolitan Pride Health Center, we do gender affirming top surgery, which I'll talk about on the next slide a little bit more. There's STI and HIV testing. There's long-term HIV care services. You can get PrEP, you can get PEP. You can get like your routine immunizations related to like going back to school or something like that. Affirming OBGYN care. And there's some, behavioral health and dental services, as well as referrals for those services. You can go to the next slide. So these are some of our locations, and I know it's a lot of information. I'm not sure if Tommy, if you're planning to send out this slide deck after, but I can also pass along all of this information to you all afterwards. But I'll also note that Gotham Health at Judson in particular specializes in adolescent and young adult medicine. So anyone up to age 34. And so that's a really amazing program to know about if you're, a young person and are looking, for that bridge between kind of, a pediatric care and adult medicine. They're really, really an amazing place to find that. And then Metropolitan, which I mentioned before, also serves all ages, and they have a pediatrician on staff specifically. And then the other three Pride Health Centers, Gouverneur, Woodhall in Brooklyn, and Bellevue, all are for adults. You can go to the next slide. So as I mentioned, so our Metropolitan Pride Health Center does do gender affirming top surgery. And so that includes, either, breast implants, breast augmentation, or mastectomy or removal of chest tissue. And so, if you are interested in that, you can find more information on the Health and Hospitals website. You can also email me and I'm happy to send it to you. And we also have this guide that there's a picture of here. And that's, it's pretty helpful, kind of walks you through what are the steps related to getting gender affirming surgery and kind of what are the requirements for it. You can go to the next slide. So lastly, I just wanted to mention a few frequently asked questions. So one common question we get, is what if I don't have health insurance, right? Can I still get services? And as I mentioned before, a crucial part of the mission of New York City Health and Hospitals is that, we're committed to providing healthcare for all New Yorkers, regardless of ability to pay. So we have, a team of financial counselors. They'll work with each person, they'll see if you're eligible for any insurance plans. If you're not, or if you can't afford to, pay for one of the low cost health plans, you might be eligible for one of our financial assistance programs where services are provided on like a sliding scale basis based on your income. So you can find also more information about that at the link and on the Health and Hospitals website. And the second question I often get is, how do I make an appointment? And so there are a couple of options. You can call the number on the slide, 1-844-NYC 4NYC. And you can ask specifically, that's like our general contact center appointment line. So when you call that, I would say ask specifically for, either Pride Health Center services or, LGBTQ affirming services, and they'll be able to connect you that way. You can also contact one of the Pride Health Centers directly by phone or email using the information on one of the other slides, or again, you can email me directly. So the email address is lgbtq@nychhc.org, and I monitor that email address very regularly. And if you want a referral specifically to a Pride Health Center, I'm happy to connect you. Or if you just have general questions or concerns, please don't hesitate to reach out. And you can go to the last slide, which again just has my our general LGBTQ email box, which again I monitor. So it's not going into the abyss. I promise you, it's going to me. That website also just has more information about our LGBTQ services. So that's all. Thank you all.
Thank you, Priya. Y'all are doing some incredible work. That's amazing. And thank you so much for sharing. Okay, we'll move on to the last of our panelists. We are going out with a bang because we have a team of representation from Sun River Health. So first we have Cynthia Jerez, pronouns she, her, hers, the Business Development Account Manager / Community Initiatives Coordinator. We have Dr. Jonathan Zellen, physician, primary care provider, specializes in infectious diseases, HIV, STI, STD, Hep B, and Hep C. We have LeVar Nero, he, him, his, regional manager of community initiatives, and Dr. Atit Patel, he, him, his, health center director. Thank you all so much for joining us this evening. And yeah, the floor is yours.
Awesome. So good evening, everyone, and thank you, Tommy, for the introductions. So my name is LeVar Nero. I am a regional manager for community initiatives in our Sun River Health organization. So Tommy, you can go to the first slide, I believe that we have, please. The About Us. So Sun River Health is a relatively new name. We actually rebranded in November of 2020. And before that, we were two strong community-based organizations, Hudson River Healthcare and Bright Point Health. The folks in New York City should be familiar with Bright Point Health. We have a history ranging for more than 30 years, as we were founded in the late 1980s during the AIDS epidemic. And back then, the name was actually Project Samaritan Incorporated, or PSI for short. Hudson River Healthcare actually was founded in the early 70s, and it was for women that came together and they wanted to provide healthcare services for the underserved populations. So a combination of 80 years of just always being able to work with the communities, be able to provide healthcare services, no matter age, demographics, gender, or immigration status as well. We can go to the next slide, please. Awesome. So Sun River Health is the largest FQHC, which stands for Federally Qualified Health Center in New York City, the Northeast. We have over 40 health centers ranging from New York City, Hudson Valley, Westchester, and Long Island, Suffolk County, and Nassau. We are a community-based organization, as I mentioned earlier, that's able to do a lot of community initiatives. You can go to the next slide, please. Awesome. So one of our, a couple of our specialties that we have are remote health and mobile healthcare. In terms of remote health, we've been able to initiate and start out with a kiosk / remote health to be able to provide services for patients, clients that aren't able to see us in person, by giving them the liberty to be able to provide those services in the comfort of their home, or actually bringing those services to them on site in terms of working with different outpatient program shelters to be able to provide medical basically in the comfort of their own home. In terms of our mobile health centers, we have 3 mobile units that are health centers on wheels that are able to provide care in the community in terms of vaccines. We were doing the flu vaccine during that initiative. We're hoping to get the COVID vaccine also on these mobile units, but also just your regular primary care in terms of patients that need checkups, sick visits, any appointments are able to be done on these mobile health centers. We've also been able to spearhead a lot of community events and initiatives. For instance, we partner with a lot of other community organizations. Then we create different events like mammogram opportunities, health fairs. We had those last year, and that's been able to just increase our visibility and also our reach, and also provide those services to, again, those that may not be able to access them ordinarily. And one of the last things I want to talk about before I turn it over to Cynthia is our community engagement team. So we have over 50 community engagement experts, which basically just means our account managers, our liaisons, staff in the actual community that's able to meet patients where they're at, be able to act as like the liaison between the community and the health center providers, be able to speak with our team and offer, again, that assistance instead of the patient calling a 1-800 number, being on hold, somebody that they can directly go to. So that's been a great distinguisher for us in terms of being able to provide those services, again, for the community and just make it easier for our patients, because when they have access that's readily available to them, it just makes it, again, more convenient for them. So again, I'm going to turn over to Cynthia and we can go to the next slide.
Thanks, LeVar. So we have, excuse me for the voice, I just came back from a trip and now I'm here celebrating my birthday. So you see the new hairstyle, guys. So all of our centers, we have tons and tons of services. As you can see on this slide, we do have primary care services. The primary care services are for adults, and we do have pediatrics. We do have outpatient substance abuse services, addiction treatment specialists. Dr. Zellen is here today. Thank you for joining, Dr. Zellen. He has been a wonderful help. We get such great feedback from all of the patients that talk to him because he is so he's concerned, but he's very informative. He educates his patients. It's not like, let me give you a prescription and then you're out the door. No, it's not that way with him. And we would like to continue that. So with the primary care services, you get education as well as case management if needed or desired for our STI, HIV, PEP and PrEP patients, Hep B, Hep C patients as well. We do have care navigators that will assist with any type of financial assistant or medication assistant programs. In the event that they're not able to pay for it, we do have partnerships that will help pay for those prescriptions as well. We have pediatrics. Dental care is on our 3rd floor. We have women's health, OBGYN. Podiatry, we don't have on the island, but we do have a great referral source where you can get a connection, especially for our diabetic patients. Those would be a little more high risk for podiatry. Mental health, we have one-on-one talk therapy and also medication management for psychotropics. We have WIC on our 2nd floor at 57 Bay Street. Across the street is 56 Bay Street. We have additional services there. Optometry, also another referring source that is not that far from the location where we are. HIV care and prevention. We have a team for this. So not only do we have a team to present here today, but we also have a team that works very closely. Chassis, Community Health Action of Staten Island, is one of our sister companies that we work with. So we do have a lot of people coming over from the PrEP and PEP hotline that do need the care. And even if they do not have health insurance, we will either connect them to get insurance if they want to apply for it, or because we are an FQHC, we do get federal funding for those that do qualify under the sliding scale discounted rate fee. And that also includes labs. You can go to the next slide. Before I talk about the next slide, I also wanted to mention that we have partnered with Uber Health. So we are able to offer transportation for those that cannot travel, that have mobility issues. With a taxi, we do set them up with mass transportation as well. Once they fill out that form with their primary care, which we can set up a telehealth. For telemedicine, we set them up with DoxyMe. So it is HIPAA compliant. They can do at-home COVID testing if they are in need of that. We can do that. And we are now also offering vaccines as long as you're eligible under the open criteria. You can go to the next slide. So we like to make it easy to access us. As LeVar said, we are a team unit and we'd like to have that one-on-one with the patients. One, it helps the client open up, the patient open up, so we know what is it that they may need. Once they're comfortable with us, it's about where to go, who do you know, what can I actually help you with. So we have a vast array of services. For referrals and appointments for Staten Island, I would be your point person. You can call me, you can text me, you can email me. I'm always available and I'm happy to help. Even if it's something not in the scope of the health center, something as simple as, hey, I have a resume and I would like to get a job, or I have a client that's in need of clothes, or they're just hungry, these kind of things. We want to have a full circle of care for all of our patients, no matter what. The kiosk is something very simple. We have an iPad that we will bring to you. So let's say the Pride Center would like to host a health fair. I can bring the iPad, can have appointments through our DoxyMe, so they can FaceTime with the provider right at the Pride Center, as opposed to coming out to the health center for any of their needs. If any blood work needs to be done, then of course that has to be done at the site. I don't have a phlebotomist with me to draw the blood at the Pride Center, but we can make it work. Transportation assistance through Mass. Anyone that has Medicaid, of course, we can set that up. And there is actually an app that we are looking at. So that way, just like Uber, you can take a look and see where your ride is at. So it makes it a little bit more convenient for the clients. Medical record requests. Of course, we would have to have a signed HIPAA consent and all the information on there filled out, and we can accommodate that very easily. Flu vaccination events. So we are working both of these with COVID and flu hands in hand, where we will have pods or certain set days where the state would give us vaccinations. They will give us the vaccines, so that way we can open up days for the community to get vaccinated. Next slide, please. Bringing care to you. Talked about the telehealth, right, over the phone, and also the kiosk. We also have a mobile health unit that does go out around town post-COVID, prior to COVID. Now with everything going on, we still haven't fully opened up that yet, but once we do, I will let you guys know. On here, you're gonna see a quick referral form. I made it very simple, just their name, date of birth, phone number, address, and any service that's needed. We do have time slots available. Some of these are available on Saturday, but there's only a select few, and that would be for televideo services, as the Bay Street location has reduced hours from Monday through Friday from 9 to 5. With everything going on in COVID, we want to keep it to a minimum and ensure everyone's safety. So we'd like to have everything set up by appointments. You can go to the next slide. Our kiosk service, just as you see there, gentleman with the iPad, and you're seeing your doctor FaceTime. So we're bringing the doctors to you. You don't necessarily need to come out unless, you know, the provider is requesting you to. You can go to the next slide. Complete care coordination. So we have medical case managers that will assist in every area of your life that you may need it. More importantly, on the sensitive topics like mental health, HIV related, HIV, mental health, and what's the other one? All these care managers, we have health home care managers. That's what I was thinking. So our health home managers will come out and visit those that are enrolled in the program with 2 chronic conditions or more. They do have to have Medicaid. They will help out with housing assistance, those type of applications, making sure you're getting your psychosocials, your PPDs, and ensuring that your quality of life is going well. And wherever we can help to manage that and make it better for you, then that's what we're going to do. So we're going to make it as a team effort where the providers You have the providers, you have the case managers, and you have the client. So we want to meet the client where they're at and where their goals are for them medically, and not only for medical purposes, but also for their lifestyle. What is the quality of lifestyle? What's missing? And how can we help with that? You can go to the next slide. So Chassis is our sister company, as I mentioned earlier. We do have rapid testing available for Hep C, Hep B, HIV. We also have counselors available. So in the event anyone does want to get more information while they're testing, the rapid test takes about 20 minutes. So it gives them a good chance to get to know one another and whatever their circumstances is. Believe it or not, a lot of people don't want to open up initially, but sitting there in a quiet room for 20 minutes, you want to start talking about something. So we get to know the person a little more and find out what's going on the reason why they want to get counseling, or if they need anything else in their immediate circumstances. Help coordinating your healthcare for chronic diseases like diabetes and asthma is part of the Health Home initiative that we're doing, just to ensure that the clients, even though they have chronic diseases, they know where to go, how to manage it, and why is it important they're taking X, Y, and Z medications, and how to continue with that. We have a food pantry located at 2134 Richmond Terrace. We do have Senior Day, in addition to general public days. On these days, there will be, not only do we sign people up for the food pantry, bring your bag so that way you can have an ID, bring your bag, and you can take home some fresh produce. Sometimes there are a lot of food that we get from not only Food Bank, but Panera and Starbucks and all these great qualities that you have. And we also get a lot of other things: socks, playpens, diapers, formula for babies. So there's so many things that we can offer with the food pantry. In addition to the food pantry, we have a mobile food pantry that goes around Staten Island. I do have a calendar, and the calendar will designate the location and the time, and they go all around town. Not only that, we do have nutritional tips and recipes for anything that we are giving out. Our HIV prevention team, they are linked to the PEP and PrEP hotline. So they will get those calls right away for anyone that has immediate needs. Someone just asked, does Chassis accept donations? I believe so. If you put your email in the chat, I will find out more about that and get back to you. Thank you for asking. We do have workshops. In our workshops, they're healthy relationship workshops to help those with whatever their need is for that moment with their families, maybe with their partners, even within themselves, on a group network of support, so that way they know that they're not alone. We do have counselors that share this information. And not only that, we like to do a little gift card at the end, just to give a little something. So if we have a women's group, then at the end of it, maybe they can get like a little nail polish kit or something cute and fun. We want to make it fun. We want people to engage and to have, to build friendships, right? Because that's how they're going to connect. Harm reduction is one of our locations at 166 Port Richmond. So harm reduction model for us is we're meeting the client where they're at as far as their usage. We do have syringe exchange, so that way we reduce the Hep C epidemic, where they're lowering the risk of sharing needles. The counselors there work very diligently with the use. Doesn't mean that we're going to tell you you have to stop using. No, you don't have to stop using right away. I mean, we're going to try to get you there, but we want it from maybe 10 bags a day to 2 bags a day. We want to encourage you to go towards a better way of life, but also to meet you where you're at and take it pace by pace. So we do have medical care team that is there as well. At our location, we also have bathroom doors that, just in case we do have a user that comes in and they are in the bathroom, they are not locked in the bathroom. So we have a very good medical team that will be alert just in case if someone does OD, right? Because we want to be aware of everything going on and make sure that we provide a safe and secure environment for everyone. Recovery support system and activities. We have across the street from our health center at 56 Bay Street is our Next Step program. Our Chassis Next Step program is open 365 days of the year, 24/7. So there's always someone available for a crisis intervention. If you want to just sit and talk, I've had clients go in there that it was in the middle of the winter. They had nowhere to go. The shelters were all booked up and they just needed somewhere to sit for a few hours, warm up, drink a cup of coffee, have a snack, and just talk to someone. And it really made a big impact on this client's life. And I'm very happy to see where they're at today. So these are the kind of things that I like to share with everyone because these stories have changed people's lives. Like us being there for them, even a smile changes someone's life. So it's very important to me. I'm very, very happy and passionate about what I do. And I just love helping people no matter what. Another resource that we have is our overdose prevention Narcan training. It is available through Zoom. If anyone is interested, please let me know and we can get you signed up. We have a wonderful counselor, the head of our DV counselor, Rose Villela. She also works with our Staten Island Justice Center. Now, we have designated a chassis closet. So we do have donations that we do accept for clothing, for diapers and formula, playpens, women's clothing, men clothing, even shoes, bags, all of these kind of things. We will we'll do an intake, we'll help the person get into a shelter closest available to them if they have nowhere else to go. And also we will provide them with counseling throughout their entire time of that DV case to help recover from any type of trauma. Connections to the health center, that's all me. We're a one-stop shop, and I would like to continue to give all of these services to you. And if there's anything that I missed or anything that anyone has any questions on, please let me know. We can go to the next slide. So all of our social support services are free. And because we are an FQHC, if you are not insured and you do not qualify for insurance, we will offer our sliding scale fee program. If you are enrolled in one of the services that we do have and you are being referred from one of the community partner organizations and you know that that client does not have the ability to pay, we just need an income verification letter and we will waive the first fee for the visit, because the point is to get the client the attention and care that they need at that moment, and to ensure that after that we get them continuity of care, that it continues, it doesn't stop just at the one visit. Our information is there. For next step, the number is 718-808-1450, or you can just stop by since it's open all the time anyway. Staff is always there and they're very happy to help. My information, I will share it shortly in the chat. You can go to the next slide. So we do have 43 locations in New York State, and these are all of the locations. For Staten Island, we do have one location. It's at 57 Bay Street, right by the ferry, next door to the post office. So it's very easy access. You can go to the next one, please. Thank you guys for listening. Thank you for all of the questions, and I appreciate your time.
Thank you, Cynthia. Thank you so much. And thank you for joining. At this point in time, I am going to